Gastroesophageal Reflux Disease GERD. It's an gastrointestinal disease. Look at this picture, shows that in medical imaging findings, X-ray, CT, detail going on. Introduction. Gastroesophageal reflux disease is a chronic digestive disorder where stomach acid or bile irritates the food pipe lining. It is a common condition affecting people worldwide, causing significant discomfort and impacting quality of life. Definition: GERD is defined as the retrograde flow of gastric contents into the esophagus, leading to symptoms or complications. It occurs when the lower esophageal sphincter, which acts as a valve between the esophagus and stomach, does not function properly. Types: 1. Erosive esophagitis, characterized by visible damage to the esophageal lining. Second, non-erosive reflux disease, symptoms without visible esophageal injury. Causes: LED dysfunction, weakness or relaxation of the lower esophageal sphincter. Second, hiatal hernia, a condition where parts of the stomach moves above the diaphragm. 3. Delayed gastric emptying, which means slow stomach emptying increase the risk of reflux. For lifestyle factors: obesity, smoking, alcohol use, and consuming certain foods and drinks. 5. Pregnancy, increased abdominal pressure and hormonal changes. Risk factors: 1. Obesity. 2. Pregnancy. 3. Smoking. 4. Hiatal hernia. 5. Certain medications, example antihistamines, calcium channel blockers, antidepressants, etc. 6. Diet: spicy food, chocolate, caffeine, alcohol, and fatty foods items. 7. Age. More common in older adults. Complications. 1. Esophagitis, inflammation of the esophagus. 2. Esophageal structure, narrowing of the esophagus due to scar tissue. 3. Baratitis, esophagus, pre-cancerous changes in the esophageal lining. 4. Esophageal adenocarcinoma, increased risk of esophageal cancer. 5. Chronic cough and asthma reflux can irritate the respiratory tract. Pathophysiology. GERD results from the failure of anti-reflux barrier at the gastroesophageal junction. The primary component of this barrier is the lower esophageal sphincter. In GERD, the ileus either relaxes inappropriately or is weak, allowing stomach contents to flow back to the esophagus. This can cause mucosal damage and symptoms due to the acid nature of gastric contents. Signs and symptoms. 1. Heartburn, a burning sensation in the chest, often after eating. 2. Regurgitation, a sour or bitter taste, acid back up to the throat or mouth. 3. Dysphagia, difficulty swallowing. 4. Chest pain, particularly after eating or at night. 5. Chronic cough, especially at night. 6. Laryngitis, hoarseness or sore throat. 7. Asthma, worsening or asthma symptoms. 3. Nausea, sometimes vomiting. Medical diagnosis. 1. Clinical evaluation based on symptoms and medical history. 2. Endoscopy to visualize the esophagus and detect damage. 3. Esophageal pH monitoring, measure acid in the esophagus. 4. Manometry, assess the function of esophagus and ileus. 5. Barium swallow, X-ray images after swallowing barium to visualize the esophagus. Nursing diagnosis. One, acute pain related to esophageal irritation. Second, risk for aspiration due to regurgitation. 3. Imbalanced nutrient less than body requirement related to dysphagia and discomfort while eating. For knowledge deficit related to management of GERD. For anxiety related to chronic illness and lifestyle changes. Management. 1. Lifestyle modifications. Weight loss, elevating the head of the bed, avoiding trigger foods, and eating smaller, more frequent meals. 2. Dietary changes, avoiding spicy, fatty, and acidic foods. Medications. Antacids neutralize stomach acid. H2 receptor blockers reduce acid production. Proton pump inhibitors block acid production and heal the esophagus. Prokinetics enhance stomach emptying and LED tone. Surgical intervention for severe cases such as Nisin fundoplication. Treatment. 1. Medications as maintained above along with pain management and anti-anxiety medications if needed. Second, surgery indicated in refractory cases or complications like severe esophagitis or Barrettitis esophagus. Psychosocial medicine. Psychosocial medicine for gastroesophageal reflux disease focus on addressing the psychological and social aspect of condition, which can significantly impact on patients' quality of life. Here are key psychosocial interventions. 1. Cognitive behavioral therapy can help patients manage the stress and anxiety after associated with chronic illness like this. Second, stress management techniques. Stress can increase the severity and frequency of GERD symptoms. 3. Support groups and counseling. Joining a support group can provide a sense of community and shared experience for individuals with GERD. For education and health literacy, educating patients about GERD, its triggers and effective management strategies can empower them to take control of their conditions. 5. Biofeedback therapy. Biofeedback helps patients gain control over physiological functions that are typically involuntary, such as muscle tension and heart rate. Prevention: 1. Maintain a healthy weight. 2. Avoid foods and drinks that trigger reflux. 3. Eat smaller, more frequent meals. 4. Avoid lying down immediately after eating. 5. Elevate the head of the bed. 6. Avoid smoking and alcohol. 7. Wear loose fitting clothes. In conclusion, GERD is a manageable condition with proper medical treatment and lifestyle adjustment. Early diagnosis and treatment can prevent complications and improve quality of life. Ongoing research and patient education are crucial in enhancing management strategies for those affected by GERD. Thank you. Have a wonderful day.